Hello, this is Dr. Q Fan. Welcome to eMedical's Nurses Corner in Urology. Today's discussion is about method to anchor Foley catheter with emphasis on the StatLock. StatLock is an excellent device to anchor a Foley catheter. It prevents accidental tucking of the Foley catheter. The anchor piece of the StatLock swivels, allowing the patient to walk comfortably. However, you have to place the StatLock on correctly and fit it on correctly. Let me show you some of the real-life examples of incorrect placement of the StatLock. On the left-hand side, as you can see, the StatLock was not snapped on correctly. That's why the Foley back dragged down and just pulling on the penis, and the patient came in complaining of pain. In the middle picture, the patient had so much pain because the StatLock was placed low near the knee there, and so the patient had so much pain he had to open the snap of the StatLock and push the catheter up near the penis, and he put together with the dental floss to hold the catheter in place. On the right hand side, as you can see, the StatLock was placed okay, but it was not snapped on correctly, and it was pulling on the penis. And whenever there's pulling on the penis, you may see bleeding from the urethra. This slide showing bleeding from the urethra. On the left hand side here, you can see the patient had the blood at the urethral meatus, and then we had to replace a new Foley catheter for the patient there. So it's very important to place the Foley catheter correctly and snap it on correctly, and also put the StatLock on the thigh correctly. The manufacturer recommends placement on the upper anterior thigh of the patient, but to achieve better result, you should place a StatLock on the upper median thigh, so it's closer to the penis, so that when the patient is walking around, the catheter is not pulling on the penis and not causing trauma to the urethra. Today I'm going to show how to apply the StatLock on the patient. So first we get the StatLock here, and we put it on there. Just snap it down. Okay. So there, and then we locate a location on the patient anterior median thigh where it's comfortable for the patient, and to make sure there's enough length, so when he's moving around or when his leg spread out, abducted, it won't pull on the catheter. In this case, he has a suprapubic catheter here, and for some people with a Foley catheter coming out urethra, we can do the same thing. The important thing is to make sure there's enough length in between the StatLock and the insertion site, whether the suprapubic tube or the Foley catheter. And the key thing also is to put the catheter into the StatLock first and see where it is there, and then you use the alcohol prep to clean the skin protection prep to clean the skin surface first. Okay, and this one you can peel back the back side and make sure this one enough length in between. So apply it down and peel the back part. And you can see now it looks very nice there. It's not pulling down. Okay, and notice the direction of the arrow. It pointed upward, and that's the correct way to do it. To remove the catheter from the StatLock, you push the button here, there, and take it down.
eMediCore, core medical education for everyone,
from everywhere.
Forever free.